Certainly, we live in an age of information, and that's a great thing. We live in an age now where anyone has access to any number of research and information. The downside, though, is that there's also a lot of information that's not validated or verified. And so when I think of hesitancy, sometimes if there's such a thing, there can be too much information, and so you have to then sort through what is true and what is not true. If you Googled vaccines, there's a lot of information out there. If you Google COVID vaccines, there's, again, even more. You really have to make a decision of who are you listening to? Who is on the other side of this page? I always encourage people that they really should make sure that they're receiving their information from a scientifically backed source of information. So a university-based site, if it's a government-based site, .gov, .edu, those are reliable. As I speak to vaccine safety, certainly I think it's a very fair and obvious question of what I've decided myself. I would not speak to safety and efficacy of a vaccine that I myself would not receive. Some people do have side effects, but the side effects that we have observed are no different than the side effects that we see from the annual influenza vaccine or some other vaccines that have been around for many, many years. And I really do want to also speak to the fact that I can say that based on the number of vaccines that have been administered. So we have a lot of data points to let us know about the safety of the vaccine. As well, there are systems in place to monitor vaccine reactions. Any organization that's administering the vaccine and has report of any adverse effect would report it through a tracking system that's monitored by the Centers for Disease Control. However, the CDC also wants the individual person who received the vaccine to have an ability to communicate directly to them what side effects you're having, and that is the V-Safe program. So you can go on the CDC's website, look up V-Safe, S-A-F-E, and it walks you through a registration process so that you can directly report to the CDC any concerns or side effects. So that really speaks to the amount of effort and attention that's been placed on making sure that not only is the vaccine safe, that we are tracking ongoing and actively for any safety issues. And that really should help to inform anyone that's still trying to decide, do they have a process around this? Do they know if there are truly side effects or not? And how are they monitoring for the safety of the vaccine? I do feel very strongly that information should be shared. And for my part, as a clinician and healthcare provider, it is my responsibility and duty to make sure that I am available and present. Being available and present means not having judgment and being very open to any number of questions. And I say this not just as a healthcare provider, but also I'm a patient in some instances as well. And if I had questions for my own provider, I would like to know that my provider is open and engaged with those questions and hears. So, what I would say to anyone then, if you have a question, ask. It's okay to have these conversations. But I think really the only way we are going to move past where we are right now is to make sure that we bear responsibility not only for asking, but we also bear responsibility for sharing the right information. Is that responsibility of where did I get it from? Do I believe it? Why do I believe it? Does anybody else need to see this and why? And so I think as long as we all hold ourselves responsible for that piece, then we will get past this period. Remain part of the dialogue. You may not have heard that thing that will convince you in this moment, but hopefully if you remain part of that dialogue, you'll eventually, that piece that needs to click for you will come across.